Hi everyone, my name is Christiania Igbin. I'm a volunteer curator at Pioneer Medical Initiative. Welcome to Curator's Crib. Today, I'm going to be taking you through the procedure for blood group testing. Okay, so there are various blood group testing that exist, but for this training, we'll be focusing on the AB blood grouping and also the rhesus positive or negative blood typing. So before I go into details, I need to remind us that your blood is a tissue that is made up of cells. Now, for each of these cells, now we have the red blood cells, we have the white blood cells, we have the platelets. Now, focusing on your red blood cells, your red blood cells contains what we call antigens. Now, antigens are what we want to look out for in this blood testing. Some people have red blood cells with the A antigens, while others have red blood cells with B antigens, while some others have red blood cells with no antigens, and some others have blood cells with A and B antigens. So the focus of this training or the focus of this testing is to determine whether or not a particular blood sample contains A antigen, B antigen, both A and B antigen, or no A antigen and no B antigen. So that was just to give us a basic knowledge on what we'll be doing. And yes, I also mentioned the rhesus positive or rhesus negative, right? So rhesus is also a type of antigen that some people have on their red blood cells. So it's similar to what I've said before. So as we are testing for the presence of A, B, or no antigen, we are also checking for the presence or absence of the rhesus antigen. So let's proceed. All right, so because we are going to be working with blood samples, I need to emphasize the need to have your latex glove. So you can see I'm putting on mine. The latex glove is very important to protect you. So this is the lancet. The lancet will be used to prick your patient to collect blood sample. This is the lancet. And here we have your methylated spirit. Your methylated spirit will be used for your swab. And when I'm talking about your swab, I mean your cotton wool soaked in methylated spirit. This is a cotton wool. So you soak your cotton wool with methylated spirit to make your swab. And what do you use your swab for? You use your swab to sterilize the sites for blood sample collection before and after collection. These are your reagents for the test. Without this reagent, you can't carry out the test. We have the first one. This is the anti-A antibodies. Now I need to mention here that antibodies and antigen go through a reaction called agglutination. So now when this being an anti-A antigen, I mean antibody now, when it mixes with a blood that contains A antigen, the reaction leads to agglutination. So agglutination, I'm going to show you what agglutination means when we proceed. I mean in practical, right? So when you see an agglutination, that means that an antibody has reacted with a corresponding antigen. So this is the A antibody, this is the B antibody, that's the reagent. This is the rhesus antibody. You know, I mentioned earlier that we have rhesus positive and rhesus negative. So also if there is a rhesus antigen, this being the rhesus antibody, when it reacts with the antigen, it forms agglutination. And then we are going to be using our dropper. Our dropper is going to be used to pick the blood sample from the site so that you can place it gently on the platform or the towel you are going to be using to read your tests. For the purpose of this training, we are going to be making use of our Petri dish, and that will be used as our testing platform. So we are going to drop our reagents and our samples on the Petri dish, and then you proceed to read your results. So this is our cotton wool already soaked in methylated spirit to make our swab, and I'm going to use it to sterilize the site of sample collection. Now that we have sterilized the site of collection, we make use of our lancet. You carefully pull this, and be careful when you are using your lancet because it has a very sharp tip. So you place this on your work area and you pierce at the site you just sterilized. Alright, now you can see the blood is already coming out. Now carefully place your lancet on the lid. Now we make use of our dropper to pick the blood sample, and we put in drops into our petri dishes. One drop each for each of the reagents we'll be working with. Now that we have gotten the blood sample, you replace the swab on the site of collection. Now we move to the next step. So now we have our blood samples in our petri dishes already. This is for the first one. I'm going to be reacting this with antibody. I'm going to be reacting the sample in the first petri dish with antibody A. You can always recognize it with the color is blue in color. The second petri dish with antibody B, yellow in color. And the last one with anti-D is always called anti-D antibody, but you can also refer to it as the rhesus antibody. Now, because we collected our samples first, we have to be very careful when we are making drops of this into the same platform. And you have to make just one drop of each. Be careful not to allow the tip of this reagent but dropper to touch your sample, just a drop. A drop of this as well. Now we are going to react. For this, I'm going to be using this part of my dropper to stir each of the sample and reagent mixture. Okay. So you stir it in a circular motion. I'm doing the same for each of my reagent mixture. Now, what we want to look out for in all of this is what I call agglutination. So agglutination is a reaction in which an antigen and an antibody, I like to use the term fight. They fight, and you just see that the blood forms clots. Now, this is the anti-A reagent with our blood sample, and I can't see any clot formation here. So it's either you see the clots is always very evident, or you see some tiny dots, but I can't see anyone here. So it means that this blood does not contain the A antigen, because I reacted with its A antibody and it's not reacting. No agglutination formed. All right. Now this is for the B as well. So you rock it in a circular motion this way, carefully. No agglutination as well. And this is for the rhesus. Now you can see the difference. Can you see the clots? Yes, so this is what we refer to as agglutination. So to help you see it better, I'm just going to place this white paper underneath it, just so you can see the reaction better. Now, how do we interpret this result? The first petri dish has the antibody A. If this was a blood group A, it means that it contains antigen A. So it is expected that the antigen A reacts with the antibody A to form agglutination. But since there is no agglutination, it means this blood sample does not contain antigen A. That means it does not have the A at all. Now this is for B. If it had formed an agglutination, that would mean that it has the B antigen, which is reacting with the B antibody. But since we put in the B antibody and there is no agglutination, it means this blood sample also does not contain the B antigen. So it contains neither the A antigen nor the B antigen. Now, for the last reagent, which is the rhesus, you can see that it formed clots, right? So it means it is rhesus positive. Now, because we are dealing with the ABO blood grouping, if it is not A and it is not B, I mean it does not contain A antigen and it does not contain B antigen, then it is blood group O. Because people with blood group O contain neither antigen A nor antigen B. So for this sample that we just carried out, this blood sample is actually a O positive blood type. That is, it is not containing A antigen, it is not containing B antigen, but it contains rhesus antigen. So it is blood group O and it is positive to rhesus, O positive. Okay, so after carrying out your tests, ensure that you dispose your lancet in the sharp box, and you dispose your cotton wool, your droppers in the biohazard bag. And for our petri dishes or whatever platform you use to carry out your test, you wash off with running water and sterilize with your swab. Remember, your swab is your cotton wool and your methylated spirit. Ensure that you return your reagents into your refrigerator. Do not freeze, but ensure that it is kept at a temperature that is below 4 degrees Celsius. Thank you very much for watching. I hope you learned something and I hope you can carry it out yourself now. Thank you.